Seeing cancer in a whole new light, literally.
The first time I ever used this, I just could not believe it, the drastic difference between the white light cystoscopy and the blue light cystoscopy.
This is really interesting. With all the high-tech advancements in medical technology, you wouldn't think the color of a light used when doctors look at cancer would make much of a difference.
Yeah, but it does now. Now a brand new technique being used at a local hospital is helping doctors find those hidden cancers and remove them. Our Dr. Frank McGeorge is here to show us how it saved one woman from having her bladder removed.
Well, the bladder is directly connected to the outside world by the urethra, so it is possible for doctors to look directly at the inside lining for cancer. They do that using a special scope called a cystoscope, and now, with the assist of a blue light, they can see and treat the cancer directly. 78-year-old Lina Lemon of Detroit was suffering from an embarrassing but common problem, incontinence.
And I couldn't control it. If I was standing up, it'd go out everywhere.
Her daughter, Shirley Scott, took her to the doctor.
My mom had been experiencing what we thought were bladder infections, but they were not.
According to Dr. Ranko Mijicinovich, a urologist at Sinai Grace Hospital, that's not uncommon.
There are many patients that I have seen in my office where they have been treated for recurrent urinary tract infections.
The tip-off is often an abnormal amount of blood in the urine.
If I would urinate, I would look back down in the toilet, and I would see the little clots.
In certain instances, sure, it is a urinary tract infection. It can be treated very easily. But if the patient continues to have microscopic blood in urine and these symptoms, I think they do warrant evaluation.
And in this case, investigation turned up much more, shocking Lina's daughter.
Bladder cancer? I don't even hear, relatives of anyone having that.
Initially, doctors suggested aggressive treatment.
The first doctor wanted to take the bladder, take it out. And I told him, no, I'll wait for the second opinion.
That's when they saw Dr. Mijicinovich. He suggested a different route, treating the cancer with chemotherapy directly in the bladder, then rechecking it with a new tool.
They told me it was a light that could detect the cancer cells. And that's what built up our, that's what made us want to try it.
Some cancers aren't obvious to the naked eye, so doctors use a special compound that sticks only to the hidden cancer cells. Just like in CSI, when an investigator uses alternative light sources to see blood or other evidence, when these cancer cells are seen through the special blue light, their color changes and they glow or fluoresce, uncovering the invisible killer.
Before the blue lights, obviously, many of these lesions were missed, and I think this is what's responsible for a high recurrence rate.
Using the blue light, the cancer lights up pink, allowing doctors to target it directly. Right now, Sinai Grace is only using the blue light for bladder cancer. Lina is grateful she avoided having her bladder removed.
We went back actually after everything was over, and he gave us those results. We were just in awe.
Now, two important points. First, if you have recurrent unexplained blood in urine, you need to get it checked out. It's often something very benign, but occasionally it can be serious. Now, the other thing is, this treatment isn't perfect for all bladder cancers, but when it can be used, it's a great option. So talk to your urologist.